for me. All right, we're going to go ahead and get started. Hello, everyone. Welcome to the Health Hub with Dr. T. I am Dr. T, as you know. Before we get started, I would like to give a disclaimer. Everything you hear on this platform and on our lives is general information only. If you have any specific questions, you can reach out to Dr. Ekwo herself, reach out to your family physician, reach out to your healthcare provider, and they will be able to direct you appropriately. But for the sake of this platform, it is general information only. So, with that being said, I would love for you guys to just welcome Dr. Ekwo to our live tonight. I met her on IG. Someone posted her, and I said, "Oh, you're an OBGYN. Can you come in my live?" And she was like, "Yes." So
Absolutely.
I'm gonna give you a minute to just introduce yourself, your credentials, and then we will get right to it.
Hey, everybody. This is my first time on the live. Thank you for having me, Dr. T. My name is Dr. Tempo. I am a board certified OBGYN here in Houston, Texas. I've been here for 10 years. Prior to that, I was in Mississippi doing my training for med school and residency. I'm a wife and a mom of three, so I know both sides of OBGYN, being the patient and being the doctor.
Awesome. If you can hear us, okay, please put a thumbs up in the chat. If you cannot hear us, last week, I was not on Wi-Fi. Go figure. So please let us know if you cannot hear us or if you cannot see us. Dr. Echo, before we get started, I was looking you up a little bit.
All
Even
right.
just from your profile picture you gave me, you had MD and a bunch of other acronyms there. So I was like, let me
Yes.
look this up because I haven't seen this in a minute. So I looked it up
Yes.
and it was like a distinguished, I guess, level of expertise that you have. Or it's not just you went to med school, you went to residency, you also did fellowship, like you
So
went
no
above.
no fellowship, but it just means
Okay.
I'm a board certified OBGYN. So I've
Okay.
passed all of my boards so that I can use that acronym.
Okay, perfect.
Mhm.
Well, kudos, congratulations.
Thank
I know
you.
that's a lot of work and I know that's a lot of studies. So thank you so
Yes,
much
yes,
for
it is.
joining us here. And I want
Thank
to
you for
get right
having
into
me.
it. I want to get right into it. I was watching Houston Live. I think Houston Live is on NBC or ABC. I'm not sure. But I
Hmm.
was watching it and they were talking about perimenopause. And when they
It's
were talking
big
about it,
right now.
sorry?
I said it's the big thing right now.
It is the big thing right now. But as big as it is, it almost seems like even when I was listening to the doctors speak on that show, they didn't have much
Hmm.
information about perimenopause. Like, really, they were, as I was listening, I couldn't really hear a lot of information. It seems like it's upcoming. It seems like we're still
Hmm.
learning about it. Can you give us, I mean, what do you know? What do you see day to day when it comes to perimenopause?
I think the reason that the information is lacking, A, because they need to do more research, but also perimenopause looks different from individual to individual, right? So
Mm.
what the phrase perimenopause is the time frame leading up until menopause. And what menopause is when you can say you've gone a whole 12 months without having a cycle. But all of that time before then, when women are having all different symptoms, that's perimenopause. For one person, it can be 5 years, whereas another person, it can be 10 years. And historically, when women come in, if they're late 30s or early 40s, and they're saying they're having symptoms and they think that they're perimenopausal, most of the time doctors will just brush them off and say, oh, you're too young for that. Whereas we're starting out that women can start having symptoms of perimenopause in their late 30s and early 40s. The
Okay.
symptoms are this very long list of symptoms.
Okay, so that's what I was going to ask is like
Mm.
everyone's cycle as women, our cycle brings on some different symptoms. For example, for myself, when I'm about to get on my cycle, I get these hot flashes, right? I get this where I may be craving something sweet or I'm not craving anything
Yeah.
at all. Or I'm at the point where I'm irritable because my hormones is out of whack and I'm just kind of like not feeling it. I don't want to be touched. I don't want to be hugged. Like, how do you differentiate if someone is coming to you for just a hormone imbalance
Mm.
versus, oh, now this is menopause?
And that's what makes it difficult to determine whether it is just premenstrual symptoms, so PMS, versus perimenopause. And a lot of women will say, "Oh, I'm perimenopausal, check my hormones." Well, perimenopause does not show up in your hormones. Typically, your estrogen levels, your FSH, your follicular stimulating hormone, all of those levels are typically within normal range. So I tell women, me checking your hormones isn't really going to tell us anything because throughout the month they fluctuate depending
Okay.
on where you are in your quote unquote cycle. And so that's why perimenopause is so difficult to diagnose because the symptoms are vast, can be explained sometimes by other problems. So a lot of women are brought or sent to their care doctor. Other huge work is done. The
Dr. Ekwo, well, let me ask this really
comes
quickly. Can you guys hear both of us
into
well?
the
Can you guys hear both me and Dr.
of
Ekwo? Hold on, I'm trying to see. You're staticky on my end, but it could be me. Last
Oh,
week it
okay.
was me. Let me see. In the audience, can you guys hear us? Can you guys hear both of us and see us okay? Oh, I don't see. It's choppy. Is it choppy when I speak? Because that was me last week.
They're saying I'm breaking up.
Okay, you
I
are
might
breaking
have to
up.
change my location.
Okay, maybe quickly, maybe change your
Okay, give me a
location.
second.
Yes. Okay. Sorry, you guys. I wanted us to hear this. I wanted to make sure that we can hear. Am I staticky? Can you guys hear me okay? Okay, it's choppy for her. Okay. Thank you. So sorry about that. She's gonna just move locations really quickly. Last week I wasn't on Wi-Fi, so I can't judge anybody. I am fine. Thank you.
Okay, I'm back. Maybe it'll be better.
It already sounds better for me. I hope
Okay,
you guys
perfect.
let us know in the comments if it's better. But yeah, it sounds really better. It sounds great for me. So I heard last where you were talking about how when most women come into the clinic and they're asking to check their hormones, and you're like, perimenopause does not even show up in the hormones. So how
Yes,
do you even
exactly.
check it?
That's the problem. So you have to have a skilled clinician and someone who's willing to sit and listen to the actual patient. Because a lot of it is just based on listening and it's a clinical diagnosis. Because again, you do labs and most of the time the labs come back normal because they are normal. The cascade of hormone are still within the normal range in perimenopause.
Oh wow. Okay, so that makes sense because even on the Houston Live, they were just talking to different women and they
Mm-hmm.
didn't even know they did go get checked. So what you're saying is consistent with what they said was they got checked, there was nothing wrong. One of
Mm-hmm.
them even talked about the husband came on the show and talked about how he went with her to the doctors. Doctor said she was fine. So he thought she
Mm-hmm.
was making it up.
Yeah.
He was kind of like, well, your blood work is good. The doctor says you're fine. Then why are you having all these symptoms? Do you really have what you say that you have? So
Yeah, and
how
that's
long? Mhm, go ahead.
I was just going to say that's the unfortunate part is that a lot of women are dismissed as either being fine or again sent to their primary care doctor to be evaluated for like hypothyroidism or vitamin deficiencies or some kind of, mental health illness,
Right.
whereas a lot of times it
Mm,
doesn't. Your lab abnormalities typically do not show, and not abnormalities, but an elevation in your FSH and then the rest of your hormone levels being on the lower side typically does not show up until you're very close to menopause. And in some women, postmenopausal.
mm. Okay. So do most women in perimenopause still have a cycle? Is it that it's just irregular or
Both. So,
okay.
but so again, like I said, because it can last for years, some
Mhm.
women, if they're late 30s, early 40s, are still having very regular cycles, but also having all of the symptoms. And when they have regular cycles, that's when people kind of shun them off and say, oh, you're fine, or maybe it's something else is going on.
Right.
Whereas, again, as you get closer to menopause, so that where you go 12 whole months without a cycle. As women start to get closer to that, yes, their cycles do tend to become erratic. Where
Okay.
you'll have some women who go months without a cycle, and then it comes, it lasts for weeks, it's heavy, and then it goes away for months. When women start having the irregularities in their cycles, that's when people start believing, oh, they're perimenopausal. But women can have symptoms and still have very regular cycles.
Okay. Oh, wow. Thank you for that. So let me, because obviously we have some men in the house, and I want to see how this also can affect them. Because, yes, perimenopause is for women, but
Yeah.
if you're married or you have a partner, what does that look like? Like sex drive? What does that look like? Dryness in the vagina? What does that look like for a partner so that when someone is in perimenopause, they're talking to their loved ones like, these are the symptoms. This is not just me brushing you off, but this is kind of how it affects me personally. Is that something that you see? Is that something that you
Oh,
discuss?
I actually see that quite often. I think that would be one of my number one complaints in
Wow.
perimenopause is that women come in and they say, I'm broken because I don't
Mm,
want to have intercourse. Either they lack the desire or they do desire to have intercourse, but they're dealing with vaginal dryness and they don't understand why they're dealing with vaginal dryness when they're so young or when they haven't gone through menopause. And again, you deal with vaginal dryness, you don't have the lubrication, it makes sex painful.
painful.
And the more
Mhm.
pain they have with intercourse, the less they want it. And then, of course, the hormone imbalances also make them desire sex less. And so I
Mhm.
do see it quite often in young patients who, again, are quote unquote too young to be perimenopausal.
So yeah, so that goes back. I guess that's part of the research that they still need to do is how early can
Hmm.
you be menopausal and how late can it go? Because you brought up a good point as to some may say, "Oh, I'm too young to have vaginal
Hmm.
dryness, or I'm too
Yeah,
young to go through this," but our bodies are so different. I can't even say
exactly.
it, that it's
Exactly.
hard to say from age 35. Like I know you're saying later 30s, 40s, but
Yeah.
I know some people that are saying their early 30s, they're starting to get that feeling.
And it's very possible, right? Because some women do go through menopause early, what we call premature menopause, women who go through menopause before 40. So of course, if they go through menopause at 40, they're going to start feeling those symptoms in their early 30s. So
Wow.
again, because it's not common, women that are that young, they tend to be brushed off. But it's there's a vast age range of when people typically go through menopause. And they say usually the age that your mom or your sisters go through menopause kind of you know, can give you an inclination of when a person will go through menopause, but it's not hard and fast. So there's no telling when someone will go through that change.
Okay. And that's important. And I like that you said that because in my home, and we're all of different backgrounds,
Mhm.
ethnicity on this live, but my background, my home, we didn't really talk about like I don't recall my mom saying, "Oh, I was menopausal at this age." So I'm over here like winging it. I'm over here like, is that PMS coming? Am I perimenopausal? Am I in menopause? Am I pregnant? Am I?
Yeah.
It's all of that, right?
And it's sad because again, we have the same background, right? So it is a cultural thing, but I think it's worldwide too, right? I have patients from all nationalities, all backgrounds, and I'll, especially when we're having that conversation, and I'll ask them, oh, do you know how old your mom was when she went through menopause? And she's like, oh, most of them are like, oh, if I even mention it, like it's taboo to talk about. Or again, historically, lots of women had hysterectomies once they finished childbearing for whatever reason, whether it be fibroids or, it was a big thing, past
Mm-hmm.
generations where women just had hysterectomies for so many reasons, where nowadays we have so many different ways to deal with a lot of the issues that women deal with that aren't hysterectomies. And so I think that also bodes it is part of the reason a lot of women don't know when their mothers went through menopause, because the moms don't know. They had, like my mom, for instance, she does not know when she went through menopause because she had a hysterectomy. And so she's like, I mean, I don't know. I don't even know if I had those symptoms or I didn't have the symptoms. So
Wow. Wow, wow. That's true. Because there's so much that happened then that wasn't
exactly.
talked about. Mama Koi Koi said they never spoke about it, and now we
Mhm.
have to figure it out on our own. And that's the whole point of this health hub. We got to figure it out together because if I have questions, I know my peers and I know those around me, we all have questions. So we do all have to come together and share knowledge and share information. But that I'm glad that you brought up hysterectomy. As an OBGYN in this day and age, are you seeing a lot of our, I guess, age group, let's say 30s and 40s, early 40s, even to late 40s, getting hysterectomies? Or are you like, there's a lot that can be solved without the hysterectomy?
I think the pendulum is swinging, right? And
Okay.
in my practice, I would say that it's 50-50, and that's
Okay.
just a rough number. But for me specifically, and for a lot of my colleagues, I know we try at this point in time to reserve hysterectomies for those people that have no other options, right? And you do have some women who come in, they're having issues, whether it be heavy bleeding, fibroids, pelvic pain, so many numerous reasons we do hysterectomies. And they come in and they're done childbearing and they don't want any other option, or they have contraindications to other options. They want hysterectomies. But I feel like nowadays we do reserve hysterectomies for those who absolutely need it. Whereas before, again, like I said, oh, you're done having kids, let's just take it out. Whereas we don't do that anymore. We do have so many different options, whether like for fibroids, we have many different options that can help manage fibroids before we get to hysterectomies.
Thank you. This is a great segue into what I want to talk about,
Okay.
fibroids.
I love fibroids. That's my thing.
Do I think you're the only one, Dr. Ekwo, that I've ever heard to
I
say I
know,
love
I know.
fibroids.
They're
So
stressful. They are
it
stressful.
is.
And they're like, I can't say that I love them, but I think it's because I get so many patients, whether it be my patients or second opinions, that come to me and they say, oh, I was only given the option for hysterectomy. And I'm like, no, no, no. Let's sit down.
Mhm.
Let's have a thorough conversation. Let's not talk about the options for for fibroids that you see on Google, but specifically based on your fibroids, these are the options that I think would be best suited for you.
Because I almost feel like, are fibroids just in every race? Is it every
Hmm.
woman? Is
Hmm.
it more? Because is there even a cause of these fibroids?
So they're still doing research, but they have no idea. One place you'll see it's, diet, and they have there's still no number one cause that they can figure out that cause fibroids.
Good question. Panic underscore Malik said, are fibroids more prevalent now than 10 years ago? Very good question.
I would not say that actually. I wouldn't say that. But again, like we mentioned, because hysterectomies were done so frequently on women
Mm,
even up to 10, 15 years ago for numerous reasons, a lot of women didn't get to the point that where they started having issues with fibroids to even know they have fibroids, right? So if you get a hysterectomy because you go to your doctor one day and you say, oh, I'm done having kids, I don't want my uterus, take it out. And he says fine, and insurance says go ahead. So that person maybe 10 years where they could have developed fibroids, right, and start having symptoms for fibroids, then would have known, oh, this is why I'm having these symptoms. But because so many women never got to that point, but I don't think they're more prevalent now than they were before.
and I think also, and I'm sure you can agree with me, medicine technology has changed drastically,
Exactly,
right?
yes.
It's like now there's not that much, for me, there's not that big of a fear
Mhm.
of, going to the doctor, because I'm like, child, I'm sure they can perform surgery on me while I'm still talking to my doctor, suture me up, or take a camera in, fix me, and I'm literally going back to work, right? Like,
Yeah,
technology is constantly
it's come a
growing. So I
long
don't know if
way.
we had the technology to even show fibroids, measure the fibroids, all of that 10 years ago. I mean, maybe they did. I don't know. You're the OBGYN. I don't know.
Yeah, but
But I
it
just
no,
think
it's definitely come along, it's come a long way. Just there's more options. Medications, new medications
yeah,
that are coming out that are not just birth control, but actually medications geared towards women that have fibroids, that have heavy bleeding. You have the uterine fibroid embolizations now. They have a lot of other procedures that can be done to treat fibroids that aren't just myomectomies and hysterectomies.
right.
So again, is the prevalence higher? Probably not. But are women getting treated more for them? They are.
Mm,
And not just saying, oh, I need a hysterectomy. No, they're more educated, so they're requesting other options, being
treatments.
treated more, so it seems like it's more prevalent, right? And more information is being put out there. We have social media where women are coming out and telling their story,
Yes.
so it seems like, oh man, this is not how it was before. No, people are just more educated and more willing to share their story, whereas again, our mom's generation, everything was hush hush, everything was done in silence. Yeah.
Yep. It's like they suffered in silence. Like
Hmm.
when I hear or I read about women who has fibroids or had fibroids, and they're bleeding and they're pain, and I'm like, oh my God, like who did at one point, I'm sure someone felt alone. Like, is it only me? Because
Yeah.
our parents' generation, they didn't talk about it.
They
They
don't
just
talk
put
about
on a
these things.
pad
Hmm.
and keep it moving.
Yeah.
So Mama Koi Koi said, I'm sure, I hope I'm saying your name right. I hope. She said, fibroids are truly stressful, dealt with them for many years. And after a few surgeries, I had to have a hysterectomy at 43. I was one of those who didn't have options,
Hmm.
which makes sense. And you hear a lot of those is they go through multiple surgeries, then it's no longer safe, and it's
Yeah.
kind of like, you know what, I want relief, I want to be pain free, I don't want to, I've heard of some people talk about having low iron levels.
Hmm.
There's just so much that women go through. She also said we're becoming more aware of fibroids compared to back in the day when it wasn't talked about. Yes, we
Yeah.
thought
Yeah.
definitely,
Yeah. Yeah.
definitely.
And yes,
So
women
when
do deal with lots of symptoms, like you said, the low iron, because again, if you're bleeding for 5, 7, 10 days or every other week out of the month, you're going to have anemia, you're going to have low iron, some women deal with significant pelvic pain because the fibroids are so
Mhm.
large. They deal with body dysmorphia because they're like, I'm thin, I've been working out, but I look
Yeah,
pregnant,
yeah,
and so it really can take a toll on women. So it's one of those where, again, you don't just leave them, right? Because you
yeah.
leave them and you wish them away and they tend to get worse, and so there are safe options out there.
When I went and saw an old OBGYN, and I say old for a reason, old OBGYN, she was doing some ultrasound and stuff on me, and she saw like a little fibroid. And she literally sat me up and said, "You're African, you're Nigerian, you need to stop eating yams. The
Okay.
yams that you eat is causing your fibroids." And one thing about me, and I'm sure some people on this live know me, I love yam. I can eat yam any type of way, any type of way. And she was like, "You need to stop eating yams, because the more you eat yams, the bigger your fibroids are going to get. And that's the cause of it." And I was like, so I didn't eat yams for maybe 8 months.
Oh, wow.
Yeah, all because I was like, "Oh my gosh, she told me not to eat yams. I don't want to have fibroids." And so I then went through some fertility ultrasounds and things, and I was like, "My fibroids, I haven't been eating yams. Have they shrunk?" And then my new OB was like, "What are you talking about? Like, they're
Yeah.
the same. This what girl, eat your yams." And
Please eat your yams.
I'm still self-conscious now. Like, I don't eat it as much,
Yeah.
but I'm so like, I'm thinking, is that what causes fibroids? Should I not eat yams? Should I not eat rice? So I said, Dr. T and yams are 5 and 6. I love yams. And now I can't even enjoy it because I think it's gonna worsen my fibroids.
But I have patients all the time who ask me, "Oh, I don't want to do anything. I'm going to change my diet." And I'm like, it's always good to have a healthy diet. But again, there's no research out there that say any of the foods
Mhm.
that we eat are in fact linked to fibroids. So eat your
Wow.
yams. Eat your yams.
Can you please speak on risk to pregnancy? You mean with fibroids? Like fibroids and pregnancy? Let me see if he Panic underscore Malik, which I think we definitely should. You guys are
Mhm.
just, this is moving way more smoother than it is, that I wanted it to. This is great. Fibroids risk status. Yeah. What are the risks of fibroids? When someone has fibroids, what does that hinder them for doing? Or what are some complications, some boundaries, and things like obstacles that they may have, challenges based on having fibroids?
So this is not all encompassing, and this does not mean because I'm saying these risks are possibilities mean that everyone who has fibroids are going to deal with these, right?
Mhm.
Because again, you read a book and they tell you have this and this is a possibility, but just because a woman has fibroids and I say this is I just a disclaimer, does not mean everyone who has fibroids will deal with this, right? But again, it's based on the location because fibroids can be in several different places within the uterus. So they can be in the cavity. So where where pregnancy is when you're pregnant, they can be in the musculature or they can be in like the outer layer of the uterus. So the ones that typically can cause pregnancy complications are the ones that are in the cavity. They can increase the chances of making it difficult, infertility or miscarriage. But again, just because a person has what they're called submucosal fibroid does not mean this will happen, but those are the small increased risk. And then overall, women who have fibroids during pregnancy, we tend to keep an eye on the growth of the fetus just to make sure they're growing appropriately. Depending on the location, it can put a woman at a risk for either not being able to try for a vaginal delivery, because if the fibroid is what we call obstructing, where there's no way for the baby to pass through the vaginal canal because the fibroids are so low, it puts women at increased risk of labor dystocia. And what that means is where you come in labor, you're progressing, but then you get to a point and you just stop dilating.
Dilating.
Why? Because of the fibroid. Puts women at increased risk for malpresentation of the baby. So where, typically around 28 to 30 weeks, baby turns to head down because of the fibroid. So the irregularity of the uterus, some women, baby never turns. So baby's breech,
Mhm.
putting them at increased risk for C-section. So those are a few of the ones I can think of off of the top of my head and the major ones.
Right. So is it a myth or is it a fact? If you have fibroids in where the baby grows
Mhm.
and you get pregnant, as the baby grows, can it potentially pause the growth of the fibroids? Like, can the baby grow faster than the fibroids, I would say?
So that is like a 50-50. So in
50.
pregnancy, fibroids can either grow, oh, I guess 30, 33, 33, 33, because they can either grow, they can shrink, or they just stay the same size.
Okay.
So that also leads to the, it's not necessarily a complication, but some women who have fibroids can have significant pain in pregnancy from what we call degeneration of the fibroid. So where, because the body is shunting the blood supply to the pregnancy, the blood supply for the
Mm.
fibroid starts to decrease. And so the fibroid starts to degenerate. And that can cause women to have significant pain. I've had women who have significant fibroids and are in and out of the ER for pain control because of the pain, not from the pregnancy, but from the fibroids.
Oh, from the fibroids.
Hmm.
So can you tell, and maybe this is TMI, can you tell that it's from the fibroids is why they're having the pain that they're having?
So a lot of times when they go to the ER, they'll do imaging, and the radiologist sometimes will read where they're the fibroids look like they're liquefying on the inside,
Mhm.
and so then that's where they call the degeneration of the fibroid, and that's, but again, it's more of a clinical
Right.
diagnosis. But sometimes it can be seen on ultrasound, depending on how good the radiologist who's reading the report.
That's awesome. I mean, I just think I love that I'm in health because I'm like, just to see the progression and just to see how we can understand our bodies more,
Yeah.
or I guess better than our mom's generation
Mm-hmm.
could. I think it's mind blowing to me. And so I do want to move because we're going to still talk about pregnancy
Mm-hmm.
and things like that, but I want to move into, someone what is your typical patient population? Like, what are they
Mm-hmm.
coming to you mostly for? Is it just, I don't know, fertility? Is it the fibroids? But when you say majority of your patient clientele, they're coming to you to see for what reason?
So that's a difficult question, because that's why I love obstetrics and gynecology, because you can see it all, and I
Yeah.
honestly see it all. I have a very heavy OB practice, but I also
Okay.
my GYN practice is equally as heavy. And so when people are coming to me for the gynecology portion, they're coming to me for their annual exams. They're
Okay.
coming to me for birth control. They're coming to me because their sister or their cousin had fibroid surgery with me, and now they want to have fibroid surgery with me.
Mm.
So mine is definitely, if I'm getting more gyne heavy, but I deliver maybe 20 to 30 babies a month, right? Um,
Wow.
yeah. So I see it all. And that's why I love OBGYN, because I see both sides. And then I also see women, girls starting as young as 12, 14, all the way until I have 80-year-old patients. So that's why when
What?
I
What's
say it's
my
different,
80-year-old
yes.
grandma coming to do?
I'm telling you, they come, we
What?
chit chat, they get their vaginal estrogen, they get their hormones. So that's why I say it is a very difficult question. I see moms and daughters. I have
Mm.
best friends that come to see me. I have, couples that come to, so yeah, I see it all, honestly.
That's awesome. So that kind of keeps your mind going, keeps
Mm-hmm.
you on your toes all day. What is
Exactly.
so let me say this. I can see why an 80-year-old is coming to see an OBGYN.
Mm-hmm.
I worked for a short period of time at a nursing home, very
Mm-hmm.
short period of time.
Mm-hmm.
And I was like, that's a lot of
Mm-hmm.
infection.
Mm-hmm. Mm-hmm. They'll tell you, I'm not dead yet. No, they're not.
No,
No,
they're
they're
not.
not. No,
But
no.
okay, so that takes me to, when you're 80,
Mm-hmm.
for women that are having like vaginal dryness, menopause, and things like that,
Mm-hmm.
do we just use the things around like the KY gel and other things to continue that desire? Because if the man can go up to 2000
Mm-hmm.
having sex, they're never
Mm-hmm.
going to stop it, right? And
Yeah.
some women, some of us are still wanting to be sexually active as we get older. Is it just recommended to just use the extraness to help us? Because with menopause, we most likely lose some of that.
hmm So, and that's where the hormones come in. That's where coming in to your gynecologist and being transparent comes in, right? And so I tend to ask my older patients, are they still sexually active? Again, that's our mom's generation. It's like, oh my God, no. And then you have the others that are like, yes, I'm married, but it's difficult. And those are the ones I have the conversation of vaginal estrogen, because again, in postmenopause, you treat based on symptoms. So if a
Mhm.
woman is not having hot flashes, night sweats, but their only symptom is vaginal dryness, you give them vaginal estrogen, right? But if they're
Mm.
having all of the symptoms, that's when you say, okay, we can try the oral stuff. And then if you're still not having an improvement in your dryness, then we can tap on the vaginal estrogen. But the great thing is, because this is such a booming field right now, they do have lots of other non-hormonal options out there. Like there's not sponsored, of course, but there's something
Right.
called Reverie. It's by a company called Bonafide, who has an amazing line of feminine products. And I usually will give, because some women are like, they're against the hormones, but there's so many options out there. And I've been listening to a book recently, and it says that a lot of women will spend a majority of their life in postmenopause. So we can't
Mm.
suffer. You know what I mean? You don't want
Yeah.
to be suffering and miserable when 40% of your life is spent in
It's what?
postmenopause.
Absolutely. Absolutely. Someone said Dr. Ekwo is the best. Oh, yes,
What's this thing?
ma'am.
What is this? I'm showing my
Is that,
age.
oh,
I'm showing my age.
yeah. Sure. Look, they're doing some click, click.
I
Please,
don't
I don't
know.
want that.
I don't know. I'm showing my age, but thank you, whoever said it. I'm not able to see the comments for some
Ada
reason.
Well Med. Ada Well Med said
Oh,
Dr. Ekwo
oh,
is the
hello,
best.
hello.
Yes. OF Tosin one says she really is. She delivered my babies.
Oh,
So
my loves are on. Oh my
yes,
goodness.
your people are here. Oh, somebody said clock it. You're supposed to clock it.
Clock
Let me
it.
stop. Let me stop. So Mama Koi Koi said, what is your opinion on HRT? Explain to us what HRT is for not everyone that is in the medical and healthcare field, please.
Hormone replacement therapy. And so that is kind of just the segue into what we were talking about. So hormone
Yes.
replacement therapy that we use in because before they would think it's only for postmenopausal women, but it can be
Mhm.
used in perimenopausal and postmenopausal women to alleviate the symptoms that they're having from menopause.
Okay.
Typically, it's estrogen and progesterone in a woman who has a uterus, and a woman who's had a hysterectomy for whatever reason only needs the estrogen. But that's what HRT is. And I am a full proponent for HRT in the correct
Mhm.
patient, right? Because
Okay.
that goes back to, why should a woman suffer because they're going through something that every woman naturally has to go
Goes
through.
through.
So
Yes.
HRT is safe. They've had many studies come out to refute the previous study that made it all women want to get off of HRT. It is safe in the correct patient, and typically we like to start it within 10 years of going through
Okay.
menopause, for it to have its
Awesome.
maximal benefit.
Awesome. Thank you for
You're
that.
welcome.
Are you seeing an increase in STIs? Are the younger generations being educated appropriately? Like you talked about having patients as young as 12.
Mhm.
Do you feel like they're educated on just sex, STI, condoms, birth
Mm.
control, all of that?
I don't necessarily feel like I'm personally seeing an increase in STIs, but I know when you read the news and the CDC, they do say there's always an uptick in, right, one STD over the other. I feel like this generation is educated, because whether or not their parents want to talk to them about it, or the schools want to talk to them about it, they're going to find out that
Yes.
information.
Yes.
Whether you want them to or not,
Or
they're going
not.
to find out the information. And so I make sure in my practice, when I see even as young as 12, I politely
Mm,
excuse the parent, ask the parent to get out of the room. Some, like me, and respect me for it. Others give me the
Mhm.
side eye. It's fine, but it has to be a safe space
Yeah.
for that patient, right? Yes, that's your child, but at this point, it's my patient, for me to
Yeah.
be able to have that conversation safely with them and to also educate them and tell them, birth control is birth control, but it's not going to protect you. Birth control protects you against the kids, but it doesn't
Right.
protect you against other things that you can't get rid of.
Yeah.
And so, I feel like this generation, though, they're learning the information. Where they're learning it from, who knows?
Who
But I
knows?
feel exactly. But I feel like they're educated. They are.
Okay. I mean, yes, everything is online, everything is
Mm-hmm.
open. So
Mm-hmm.
they are being educated. So I saw on, and I'm sure everyone saw it, I think the Shade Room carried it, everyone carried it, how now women in their 40s,
Mm-hmm.
there's more of a higher level of pregnancy in women in their 40s than teen pregnancies. One of my favorite shows, Judge Me If You Want To, on this live. One of my favorite shows was Teen Mom.
Oh,
I mean,
on
and my
MTV. I remember.
yes, and my mom used to make me watch it to be
Mm,
like, this is why you shouldn't be having sex because
yeah.
look at her struggling. Look, so moving from that to now women in their 40s popping out babies left and right. Like,
And they are doing it with such
yes,
grace. And I
yes.
have women all the time who come in and like, oh my God, I haven't started having kids and I'm 38 or I'm 40. And I'm like, 40-year-olds are rocking these pregnancies, right? And I think it's funny because we were talking about this recently, where nowadays when we see, younger women, even young 20s, right? No judgment. This is which is just a conversation. But
Right.
we're like, ooh, she's only 20. She's having a child. Whereas back in the day it was like, oh my God, she's
She's
40. She's having a child. But I
yes.
think it's the pendulum is swinging. It's a constant thing, right?
Completely.
And so now women want to be established. They want
Mhm.
to, get their education, get
Yes.
established, have
Yes.
the white picket fence per se before they
Yes.
embark on that journey of having kids. So yes, women are having kids much later now than our parents' generation, who go to school, go to school, go to school, you graduate, and then all of a sudden, where's your husband? Where are your kids?
Right.
And so, yeah, I have my range of OB patients. I range from 18 to
Wow.
45. So,
Wow. So
mhm.
then can we stop, when I say we, I don't mean we. Can y'all OBGYN stop calling us that are having babies later on geriatric?
I do not use that word, and ask any of my peeps on this live. They will tell you I hate that word. I absolutely hate that word. When any patient utters that word, I tell them that is not correct. We use
Good.
advanced maternal age. I don't really know where geriatric came from. It's one of those that kind of just was thrown out there, and people, but we don't even have that terminology in the ICD-10. So our
Oh,
diagnosis,
yes.
that's not a terminology. So I don't really know where geriatric pregnancy came from, but anyone will tell you I hate that term because I feel like it's derogatory, right?
Yes.
You make women think like they're having babies in the nursing home. Because that's what
Absolutely.
that's what I think when I hear geriatric, like someone in the nursing home is pregnant. But I don't use that terminology, and it's not a medical term. I don't know where it started, but it's not a term we like to use.
They need to throw that away.
I
I
agree.
remember
Throw
when
it in
I
the
was
trash.
pregnant. Look, when I was pregnant, I was
Mm.
cute. I was like, I will make sure I got my good wig on. I'll make sure I'm strutting in there. I was still wearing my heels. I said, who's your geriatric?
Yeah.
So you brought up a good point, and I kind of want to talk a little bit more about that because I guess a lot of my audience are in probably their 30s, their 40s,
Hmm.
50s. And you said something that really warms my heart. It's like someone that hasn't had a baby and they're 38 or they're 39 or they're 40, and they now their bone of bone have come, the love of their life is here, and now
Hmm.
they want to start a family, and you encourage them
Oh yes,
to
one
have a
hundred percent.
family.
Wholeheartedly, I encourage them. I saw a 42-year-old last week who was in tears, and I was like, why are you in tears?
Oh,
Let's make this happen.
yeah.
And because again, what do they claim the risks are over 35? Decrease in fertility, yes, we know that,
Right.
and then an increase in chromosomal abnormalities. But we have all the tests now to test
Yes.
early to see
Yes.
if a pregnancy is affected. And you will be shocked at the number of patients that I have it that come in, that have pregnancies affected by chromosomal abnormalities that are early 20s, right?
Wow.
So yeah, so I always tell my patients, don't let your age stop you from something that you've always desired for an entire lifetime.
Mm,
Again, that goes back to where I said, just because it is a possibility doesn't mean it's going to happen. And so just because they say over 35 increased risk of chromosomal abnormalities, I can count on my hand how many patients I've had late 30s, early 40s who have a pregnancy, complicated by like Down syndrome or
yeah.
other chromosomal abnormalities. So I say go for it. Do not let age stop you.
Yes, and I'm seeing that more and more because you're a lot of us women are shied away because we're like,
Mhm.
oh, what is that phrase they always say? It's like, you're getting younger, your eggs, and it's like,
Mhm.
okay,
Yeah.
I know my eggs.
Yeah.
So it's good to see that again, technology, healthcare, things are changing.
Hmm.
There's much more instruments that they can use to kind of check levels and so forth. Dr. Boo, period KI said, I had a 39-year-old patient who unfortunately a pregnancy with Down syndrome. What is the likelihood that it can reoccur again? That was a huge concern for her.
So that's more of a genetic, like a genetic
Yeah.
counselor kind of question, because again, we know that most of the time Down syndrome is it's a spontaneous thing. It's not due
Mhm.
to the fact that the parents have genetic, because we all have genetic material, right?
Right.
And there are certain things that when they happen in pregnancy, the chances of recurrence are high. So I can't give an exact number off the top of my head, but we know that Down syndrome is a sporadic kind of chromosomal abnormality. So the chances of a future pregnancy being affected are on the
Again.
low side, but I can't give you an exact number.
Right. Thank you for that. So Mama Koi Koi said, my cousin has two beautiful children. She had them when she was 51 and 53.
Okay.
Kudos to her.
Yes.
Because what? At 51, 53, I'm not lifting nothing. My whole community about to raise these kids because that's
I
a lot.
totally agree. I agree
What?
with you.
That's your body. And I feel like our bodies, again, maybe because we're busier now as women, this
Hmm.
generation, we're working out, we're trying to drink water, wear the right hair, do everything.
Do
It's
all the
like,
things. Yeah.
it's a lot on
It
us.
is.
It is
It
a
is.
lot.
It is. It's funny that you say that because my 6-year-old, I have 3 kids, and my 6-year-old last week said, Mommy, I learned in school that back in the day, all women did were have babies and take care of the house. He was like, but it's different now. I was like, yeah, it's different now.
It is different. It is 100, like, it is 100% different. I don't even know what our kids will be. I can't even think that far because I'm like, what?
Yeah.
Someone said, along the lines of previous question, any autism risk with all the misinformation out there? Can you clear it up? Is there anything to clear up?
I can't.
Autism,
I'm not
yeah,
going to lie. I can't because there's
yeah,
so much information out there. We don't really know what is true, what is false. So
yeah,
I won't even touch on it.
absolutely. It
More
is.
research needs to be done.
That's where I was
That's
going.
it.
That's
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 it.
where I was going. Is research, research,
Hmm.
research. We
Yeah.
need more research. I love that you encourage your patients to go with their dreams of having children. The earlier woman that had a baby at 51, 53, she had tried for 10
Mm,
years before
mm.
having her children.
Yeah.
So,
See, never give up.
yeah. And I think, and I guess this goes into even personal for me is when I had my OBGYN and I was pregnant, my relationship with my OBGYN was so good. Like
Mhm.
so good. And I feel like that is so important. You touched on one thing that I think a lot of just healthcare professionals, not necessarily physicians, I would
Mhm.
say, lack is just that personal skills. Is that
Mhm.
sitting down and actually talking to your
Yeah.
patient,
Yeah.
and
Yeah.
getting to know your patient, knowing their desires and all of that
Yeah.
is really, really important. Underscore neighbor said, question in DM. Can you send it privately? Because I can't open my DM right now, but you can send it anonymously if somebody wants to send a question. I think there's a question mark at the bottom of your screen that one can send questions to. We're about rounding up, so please send your questions ASAP. This hour goes by
It
fast.
does. It goes by fast.
So I want to talk about just vitamins. I read
Mm.
somewhere, I don't know, I read all random stuff. So I read some research and then I read non-research. But it talked about just taking prenatal vitamins for life. Someone was like, if it's if it's healthy enough, how did they say it? If it's healthy enough to take while pregnant, it should be healthy enough to take for life. Are
Mhm.
there any risk to taking like prenatals throughout just your life
Not
as
at all,
women?
because the only thing that sets a prenatal apart from a woman's vitamin is the folic acid, and we know we
Okay.
need folic acid to help fetal development, but specifically to help prevent neural tube defects in pregnancy, which is what makes the difference with prenatals versus regular vitamins. So it's 100% okay to continue a prenatal vitamin for the duration of your life, because again, taking in folic acid is not harmful just because you're not
Okay.
pregnant. So I tell patients, especially those that deliver and they want to continue breastfeeding, continue taking your prenatals, because a lot of times once they stop taking prenatals, they're not going to take regular vitamins anyway. So
Anymore.
it is 100% okay to take prenatals forever.
Okay. Yes, the person that put the question in the question mark, I got it. Send your question right away. You have like 1 minute to send your question. Okay, Dr. Ekwo, what are some tips in just if a woman is here or a man is here and their wife or their loved one doesn't have a OBGYN, or what are some tips that you can give in just coming from your field?
And they're looking for an
They're
OBGYN.
looking for an OBGYN or they don't even know if they should have an OBGYN. Should every woman have an OBGYN?
Yes, and come see me, of course. Put it in my
She said,
plug.
Google me.
Put it in my plug. But yes, in all honesty, yes, every woman should have an OBGYN, whether you're in the era that you're having babies or you're in the era before babies, after babies, but every woman should have an OBGYN, whether you're coming to talk about your cycles, coming to talk about birth control, or just coming to get your annual exam, your breast exam, your not everyone needs a pap smear every year, but your wellness
Mm.
exam, yes. So absolutely, yes. And come see me. I'm
Yes.
always accepting new patients.
Dr. Ekwa is ready. She said, come see her. Look in Google, come to her office and go see her.
There you
This
go.
was so informative. Thank you so much for this and all the lives. Yay! I get something good each time. Woo! I have amazing network of people that just come in and share information. Will this live be saved? It was very informative. Yes. This live will be uploaded to the Health Hub with Dr. T's YouTube page. All previous lives are there. So it would get uploaded, I believe, in about a week. Just editing, cleaning stuff up, making it right for y'all. And then you can always go in there and watch it at any time. Wow, thanks for the information about prenatal vitamins. Yes. AC Triple A Mom 823 said ACOG has cervical cancer screening guidelines 21 to 30 every 3 years and every 5 years after age 30, which
Mhm.
HPV DNA screen. However, I have seen OBGYNs do it annually. What are your quick 30-second thoughts?
I agree. I won't allow anyone to go out 5 years. Yes, I tell patients I lead with I know what the ACOG guideline or the cervical cancer guidelines say, but if a woman wants her annual pap smears, I give it to her. You're here, I'm down there, let's do it.
Let's do it. All right. Someone in the private said thoughts on reoccurring BV or yeast infections, causes or treatments.
Take your probiotics.
Pro-
Probiotics. There's lots of vaginal probiotics, not just any probiotics, but specifically for the vaginal flora. Very important to
Mm.
take probiotics. Make sure you're eating a healthy diet. No underwear at nighttime. Cotton underwear. I'm just trying to move fast. I know we're
Yeah.
out of time. But
Yes.
probiotics,
Go
probiotics.
go see Dr. Ekwo.
There you
Go
go.
see
There you
her.
go.
And she will
I'll
give
get
you
you
a
taken
list
care
and
of.
she will
Yes.
break it down and you can try different things and she can take feedback. So go
Absolutely.
see her. All
Yes.
right, last questions. Any information on pelvic congestion?
Oh,
30
that's a
seconds, Dr.
whole
Ekwo.
nother topic because some people believe it, some people don't. But essentially, it's varicose veins of the pelvic vasculature.
Oh, okay.
Hmm. Hmm.
Go see Dr. Ekwo. I'm about to come see you because
Come,
I got a
girl.
couple more questions.
You'll get the
So I'm
VIP service.
one thing I like, VIP is what I like.
But
Someone said
everyone will
for
tell you
real,
I give everyone the VIP service. But
don't tell me that. Don't tell me that. I get VIP. Leave everybody else
you're
alone.
getting
Someone
VIP.
said,
Don't worry. Don't worry.
for real, she's one of my favorites. You have a lot of people on here. Can you recommend any great OBGYN in the Dallas area? Currently needing one ASAP. Ooh, Dallas.
Mm. Ask the person to DM me, and I think I can send a few.
DM Dr. Ekwo. She can
Hmm.
send you a couple.
Yes.
Thank you all so much. It's never enough time. I promise you. It is not, but we're going to have you back because
Yes,
there is
please. I
so much.
enjoyed this.
Wait, wait a minute. I told you you would. But there's so much we have to get into. But thank you all so much. Thank you, Dr. Ekwo. You are
Thank you for having
amazing.
me. Thank you
I
for having
appreciate
me.
everyone. Have a great rest of your evening
You
and
too.
blessed week.
You
Check out
too.
YouTube. Please share this page with everyone. Let's get to 1,000, you guys. Thank you
Yay.
so much. Have a great week.
Bye.
Bye.